So the third wave is now here, and if you look at the latest coming in from the capital, you already see doctors getting impacted by it. 23 resident doctors of top hospital in Delhi have tested positive for Covid-19 just in the span of 1 week, even as the national capital is reeling under sharp spike in cases. The medics at Safdarjung hospital have mild symptoms and have isolated themselves as well. That's what the senior doctors are saying. No case of Omicron has been detected so far, at least. But remember, the genome sequencing takes time, so we don't know just yet. Meher Pandey joining us for the very latest. 23 resident doctors of top hospitals there. Meher, is a worrying number.
Exactly, Sonal. It's when the doctors treating COVID patients who start getting positive in mass numbers, that's when we know that the third wave has really arrived. That's what everybody has been saying. The third wave is now well underway. The national capital's COVID cases have been increasing dramatically. Just in the last 24 hours, they have increased by almost 30%. And there were over 4,000 cases on Monday. In a week, cases have increased by over 1,000%. So the third wave has well and truly begun. The health minister has actually said that Omicron is actually driving this wave in the national capital. He said 84% of cases detected in the last 2 days were Omicron cases. So it's now become the driving variant in this wave. But if we actually look at the number of cases that Delhi has detected of the Omicron variant, these are numbers that are reported by the health ministry. Delhi has detected only 351 cases so far. But if we look at how many cases Delhi has recorded in the last 24 hours, they should be, if we go by 84% of cases, Omicron should actually be 3,443 actually. So we may be under detecting our Omicron cases, and this is true for across the country. Major metropolitan cities, including Mumbai, have said that Omicron is now 80 to 85% of all COVID cases. So right now, when we look at how many we have detected, it's well below what it actually could be, going by the samples that have been tested and detected so far.
All right, so, that's an important figure, Meher, that you're pointing out, that the number of Omicron cases actually could be much less than what actually is the reality. And like I said, it is because we are quite slow in doing our genome sequencing as well to kind of come to a conclusion over there. But just going back to the Safdarjung story, Meher, do we know the average age of these doctors, and how has this impacted the functioning at Safdarjung hospital?
So these doctors have tested positive over the span of a week. These are resident doctors, junior doctors who were actually protesting just a few days ago. They have returned to work, and so these young doctors have already tested positive because COVID wards are now filling up quite rapidly at LNJP hospital as well. So the fact that they are testing positive also means that it's patients who are not in COVID wards who are also transmitting COVID to other doctors.